name is Carly. I am going to be your nurse for the day. I just want to start. Can you tell me her name and date of birth? Okay, perfect. So I was watching outside at our nurse's station, and it seems like Miss Caroline's stats have been just dropping a little over time. So I just want to come in and do a quick assessment. I brought some suctioning stuff with me just in case we need to suction her. Have you seen that done before? Okay, perfect. I know it can be a little weird and scary at first. I just want to make sure. So I'm just going to do a quick assessment. It does look like she is having some mild retractions, and her dressing is still dry, but it does look like I see some secretions and mucus in her trach. Alright, and from listening to her, she does sound a little junky and diminished. So I first just want to check and make sure her oxygen tubing isn't kinked and is hooked up to our flow meter, which it is. And her sats are still 90%, so I think it is appropriate to suction her. And Mom, do you have any questions about that or concerns? Okay, perfect. I'm just going to set my stuff up and we will suction Miss Caroline. So I'm first just going to make sure that our suction comes up to 125 or in between 125 and 150. I'm going to get our ambu bag. I'm going to wait to hook this up to oxygen just so Caroline can still be getting that while I set up my sterile field. I have my mask. I would peel that back. And this is where I am going to unhook Miss Caroline and put on my gloves. I want to just make sure my back doesn't turn to my sterile field. And when I hook up that ambu bag, I'm going to turn it up to 10 liters so that we can give her some breaths to hyperoxygenate. Collar off. I'm going to be using my left hand for sterility. And I'm going to grab my suction and dirty my right hand and hook that. I'm going to make sure it's working. And I can do this by testing it with this saline. and it looks like it's working. Okay. I'm going to hyperoxygenate Miss Caroline with a few breaths. I would want to do this with her respiratory rate. Now that we've hyperoxygenated her, I am going to go down to my pre-measured length or until she coughs. And when I do that, I'm going to apply suction and twist to come out. And as soon as I do that, I'm going to want to hyperoxygenate her again, just since she has been off that oxygen and we went into her airway. And then I'm going to clear any secretions out from our catheter. And if I want to suction again, I would want to wait 1 minute. But it appears that Caroline has bounced back from that little bit of suctioning. So I'm going to reapply her oxygen and turn her back down to 2 liters, which is what our doctor has ordered. And I see that her oxygen saturation has come up to 98%, which is great. Her work of breathing has increased, so I see less retractions. And I'm going to listen to her one more time. All right, and it sounds like we have more air movement coming to her lungs. I would want to give Mom her call light and her bedside table. I would clean up, put my ambu bag away, put up Caroline's rails so that she will have a safe environment in her crib. And I'm gonna do hand hygiene and head out.